condition where the joint gets inflamed because of the damage to the cartilage or because of the inflammation in the synovium. Broadly speaking, there are two types of arthritis. One is the rheumatoid arthritis, the second one is age-related arthritis. Now we are mainly dealing with the degenerative arthritis where the cartilage in the joint at the ends of the bone, as you can see here in this image, this is the cartilage which is at the end of our bones which forms the joint, and this cartilage gradually gets damaged as you can see here, and that leads to painful joint movement. This is stage 4 when whole of the cartilage of the end of the bone is damaged, and that leads to pain even while sleeping, and patient is having painful steps, even single step is painful. So when patient is having pain because of this damage in the cartilage, that is called degenerative arthritis. Usually starts around 50 or 50 plus, leads to stage 4 at around 60 years of age, and then patient requires some kind of intervention so that he or she can get the relief from the arthritic pain. The best treatment is to do regular exercises, cut down on your weight. If you are overweight, 1 kg reduction in your weight will lead to 8 kg less load on your knees while normal walking, 16 to 20 kg less weight on your knees when you are climbing upstairs or when you are standing from sitting position. Sometimes, even in stage 1 and 2, the patient's knee is so much damaged that they feel significant pain. For those patients, we have injections available. We give the synovial fluid injection. It's called synovial fluid replacement therapy, and that gives relief for 6 months to 2 years time. Once the patient reaches beyond stage 3, that is stage 4 or stage 5, which is nowadays we call it a complication stage, when the deformity is so much that the bone is either broken or there is significant defect at the bone ends, that stage patient requires surgery. Now what we do in joint replacement surgery? You can see in this model that the bone on the side is as your normal bone. We don't remove this bone. Most of the people think when we show them this model that this whole thing will be put inside their knee joint and this is the knee replacement surgery. It's not like that. It's just this surface which got damaged in this photo. The cartilage which got damaged is replaced by just 8 to 9 mm thick of the metal sheet, which we give the shape of this bone by the help of different instruments and computer, and also on the lower surface the damaged cartilage is removed and only the surface of the bone is replaced. So it's actually a surface replacement rather than a total knee replacement. Now there are two different techniques of doing a knee replacement surgery. One is the conventional technique where we check the alignment of the limb. Like if before the surgery your knees got bent either in outer or inner aspect. So after surgery your hip, knee and ankle should be in one line. Now we check the alignment by two ways. One is the conventional method where we put one rod inside this thigh bone to see that we are in proper alignment. Now this thigh bone is curved bone and the hip joint is slightly medial to this long bone. So we take that angle. Different surgeons take either 5 degrees, 6 degrees, 7 degrees based on their own whims and fancies. Now with computer tells you where the hip joint is, where the knee center is and where the ankle center is. So your alignment is accurate. With your computer, if you are aligning your joint, artificial joint in a proper way, these all joints, they have very less wear rate and will last for more than 20-25 years. We have different implants available. Few of them they bend up to the 90 degree and then there is knees which bend up to the 135 degree.
ठीक है, ऊपर लीजिए माता जी, रिलैक्स। तो पैर सीधे, बिना मोड़े नीचे रख दीजिए। वापस आइए नीचे।
All said and done, we advise the patient you can bend your knee, you can sit cross-legged in the bed, but we don't allow them to sit on the floor regularly.
बिल्कुल सीधे रखिए गर्दन, आराम से चलिए।
ठीक है, अब चलो आगे। सामने देख के चलना। इसके साथ चलो, इसके बाद बढ़िया चलो, सामने देख के चलो।
सामने देखो सामने।
नीचे देख के चलेंगे तो पैर अटक जाएगा, सामने देख के चलेंगे तो कंट्रोल रहता है पैर का। एक बार मारने के लिए। So you just saw one patient, a 62-year-old lady with a significant deformity of both the knees, and both the knees were bent like this and had a flexion deformity where the knees were not touching the bed when she used to sleep. And it was just third post-op day after both the knees were done, and people get afraid of the surgery because it's a long surgery. How are we going to walk? How many days going to take? And third day, if you noticed, the gait of the patient is walking like a normal patient, moving one leg forward to the other leg. Rather than if you see other patients who walk with 1:1 gait, where the other leg just comes near the previous leg. So we focus on the normal gait pattern from the beginning. And third day, if you see the patient walking like this, see at 3 weeks, 4 weeks, the patient will be walking as good as any other normal person without any knee problem. The second thing is that patient feels that surgery is very long, it's going to take 3-4 hours. It just take 45 minutes to do the surgery. Why we are successful? Because we have a complete dedicated team of the anesthetist, the doctors. Dr. Prince is there with me. He's working with me for last 2 years, and we give a comprehensive care to the patient. We have a dedicated physiotherapy team. You have seen the setup. So patient will not feel neglected anywhere during the course of his treatment, his or her treatment.